Hi, my name is Professor Keyoumars Ashkan. I'm a professor of neurosurgery. My NHS is based at King's College Hospital in South East London, and my private practice is based in Harley Street as part of London Neurosurgery Partnership, primarily working in the Harley Street Clinic in central London. In terms of surgery, again, there are lots of innovations. For example, now we can use dyes during surgery to make the tumor fluoresce and look at different color from the rest of the brain, which obviously makes it easier to recognize the abnormal tissue and achieve a better surgical removal. Also, we can monitor the patient now during surgery, can even do the surgery awake, which allows us to increase the safety of the operation to ensure we remove as much of a tumor as possible with as little deficits as possible. And probably the newest technology we just started using is using laser through a very minimally invasive keyhole approach, using a robot to improve the precision to place this very fine laser catheter deep inside the brain into the tumors, inaccessible areas that before we couldn't even do open surgery for those areas, to then use the heat generated by the laser control on the real-time MRI scan to increase the safety, if you like, to just burn the tumor from inside. As I say, very useful for inaccessible deep-seated tumors that previously had no open surgical option.
And what are the most common movement disorders that you see in your practice?
So one of the things I do regularly is surgically managing patients with movement disorders. The commonest type we see is probably Parkinson's disease. We also see a lot of patients with hereditary essential tremor, so shaking of the arms or legs without Parkinson's disease as an isolated problem. And also less frequently patients with dystonia, which is an abnormality of the muscle movement and function that can occur in both pediatric age group and adult age group. I think the youngest child I've operated with dystonia was just over 3 years old, so we can even operate at that early stage. And the most frequent technique we use is what we call deep brain stimulation, whereby we very precisely place electrodes, which are, if you like, they are like microchips, if you like, deep inside the brain, and then we can connect those to battery pacemakers that will then drive electricity through those critical parts of the brain to correct the abnormal movements.